All right. My name is Jack.
My name's Eugenia.
And I'm Rachel.
Today we're going to talk about the HIV and the AIDS. So our global health issue is HIV and AIDS, and our sustainable development goal is the quality education. So, as you know, since the HIV is untreatable disease, the most important thing is to prevent the disease and reduce the risk of transmission to other people. So the most important factor to accomplish these goals is to provide a simple educations to people who aren't aware how to protect, prevent, and manage the disease. So, what is HIV? That I'm sure that from our nursing school experiences, we've heard about HIV and we've studied about HIV at least just once, or you're just aware of HIV because it's so prominent that we all know about it. According to CDC, in 2025, HIV is a virus that attacks the body's immune system, which leads to AIDS without proper treatment. The reason why it's important to manage is that there is still no currently effective cure. It is a lifelong disease once you have it. So, like we mentioned, once you get HIV, it is important to know how to manage, what routes to transfers to other people, or what supports you can get from other sources, and how other people view this disease. So, here are the symptoms. Once you get the HIV, you may have a fever. The fever occurs and a continuous night sweats. You can also experience the weight loss. You can experience the rapid weight loss as well, and a diarrhea that's unusual diarrhea that lasts more than a week. And then you can also experience the swelling as well, prolonged swelling of the lymph glands in the armpits, groin, or neck. Other symptoms are extreme and unexplained tiredness, such as fatigue, sores of the mouth, anus, or genitals. We can also experience the pneumonia symptoms, and then red or purplish blotches on or under the skin or inside the mouth, nose, or eyelids. You can also experience memory loss, depression, and other neurological disorders as well.
So, what causes HIV/AIDS? According to the CDC, HIV can be transmitted by exposure from infected bodily fluids such as preseminal fluid, semen, vaginal/rectal fluid, human milk, and blood. And then causes include unprotected sexual intercourse, sharing needles, perinatal transmission, which means transmission before the birth of the fetus, during pregnancy, or then after delivery, or sharing drug injection equipment. The vast majority of HIV infection worldwide occurs due to sexual contact. An estimated 80% of HIV infections in the world occur due to heterosexual transmission. However, in the US, the statistic does not hold true. According to the United States Centers for Disease Control and Prevention, HIV fact sheet, male to male sexual contact accounted for 70% for all new HIV diagnosis in the US, while heterosexual contact accounted for only 22% of all new HIV diagnoses in 2021. So, some risk factors: the World Health Organization consolidated guidelines for HIV identify five key populations that are disproportionately affected by HIV. They include men who have sex with men, sex workers, people in prisons and other closed settings, people who inject drugs, and trans and gender diverse people. Some social determinants of health include poverty, insurance coverage, education, and income inequality. According to the 2022 HIV Surveillance Supplemental Report for Social Determinants of Health in the US and Puerto Rico, it was found that adults who lived within the highest level of poverty were the highest with HIV diagnosis Adults who had the lowest health insurance or health coverage plan had the highest HIV diagnosis. Adults who had the lowest level of education had the highest level for HIV diagnosis, as well as the highest income inequality had the highest HIV diagnosis. These are significant social determinants of health that affect people, and these are just some examples and not the entire list. The CDC, that is all.
All right, so this is the image of the that I got from the Sustainable Development Goals website. There are multiple goals that were developed from a lot of people, I'm assuming, but here is the Sustainable Development Goals that we've come up with. I've categorized some of the numbers into same group because there are way too many categories that we could discover and we could cover. So number one, I've categorized 4.1 and a 4.2. Increase access to HIV inclusive education in all primary and secondary schools by 2030. So only 20, according to UNESCO, only 24% of boys and 22% of girls aged between 15 and 19 have a comprehensive knowledge of HIV. And number two, we categorized 4.3 and a 4 and a 5.6. So eliminate gender disparities in HIV education programs to reduce infection rates among adolescent girls by 2030. So, for example, from according to UN AIDS, girls in Eastern and Southern Africa have been made in reducing new HIV infections among adolescent girls. And number three, it is categorized by 4.7 and an A. Train 100% of teachers in developing countries to deliver HIV-related health education by 2030. According to the UNESCO that was written in 2017, especially in developing countries, teachers are the key factors to accomplish to meet the goals of Sustainable Development Goals 4, which is the quality education. And number four, ensure inclusive learning environments for students living with HIV by 2030. And then it is categorized with 4.B and a 4.C. According to WHO, youth living with HIV have reduced school attendance due to stigma. And also, HIV transmission can be reduced up to 96% with an appropriate education. And this is a slide about HIV and health promotion. So, number one, education and awareness campaigns provide evidence based information about HIV transmission and a prevention. And number two, treatment and prevention, promoting ART, which suppresses the viral load and it prevents the transmission between people. And number three, health policy and global partnerships, collaborating across international organizations to address the inequalities. And number four, testing and an early diagnosis, encouraging a routine screening to reduce the undiagnosed cases as well.
So talking about the current prevalence of HIV in the United States, there's a lot of disparities, but HIV mainly impacts people who are Black or Hispanic, people who live in the US southern states, men who have sex with men, people using injected drugs, as and in general compared to the general population. So our southern US states have more intense HIV epidemics than other regions, typically because there's a lack of expanded Medicaid, and our southern states are usually more likely to have rural counties with the high HIV prevalence. That's and the an article by Sullivan and colleagues mentioned that the southern US states also have the US cities with the highest rates of new HIV diagnoses in the past decade. So disparities in the South and in general are due to those large gaps in health insurance coverage, like I said, because of the absence of the expanded Medicaid program, And there's a general shortage of healthcare providers. There's a lot of low health literacy, high rates of sexually transmitted infections, and just generalized stigma with seeking HIV care and prevention services in the southern states. And as we've mentioned, HIV is generally more prevalent in people who live in the poorest areas and people in areas with the highest income inequality in general, as well as people with the lowest level of education because they don't have the education on prevention and transmission. So, talking about the impact of HIV and AIDS, an article by Emelick and Turnbull in 2023 discussed that within the African born community, especially in the United States, women are more likely than men to keep their HIV status hidden. And that's because of the stigma that comes with disclosing their HIV status. HIV is also viewed as a shameful disease, and because women are held to a different standard than men culturally in the African born community, the stigma surrounding HIV is much higher for women. They're often also fearful of being labeled as sex workers. The HIV related stigma leads to inadequate health care and prevention. So, for example, Emlich and Turnbull mentioned African immigrant women reported that they avoided healthcare settings in general due to fear of inadvertently disclosing their HIV status. This stigma has been attributed to the late diagnoses of HIV and AIDS among African born women, as well as delayed testing. And that same article also discussed that intimate partner violence is an issue in the community, and it's a hidden problem that's not talked about nearly enough among the African immigrant community. And this puts a quote from them, this puts African born women at risk from acquiring HIV because of fear of asking their partners to remain faithful or to use condoms. And some African born women report hesitancy about leaving abusive relationships for fear of having to disclose their HIV status to a new partner. And this isn't only in the African community, this is in general, women in general in the United States as well. A different article by Paquette and colleagues in 2025 stated that ART, antiretroviral therapy, from 1987 to 2023 was estimated to prevent millions of new infections and AIDS cases to avoid HIV-related deaths. So this investment was estimated to provide a return of 2.11 trillion US dollars from 1987 to 2023. Each $1 spent on antiretroviral therapy was estimated to create a revenue of $4.30 US dollars to the public sector in the United States. And results remain generally positive when longevity effects were included. That article is cited. But in general, antiretroviral therapy has a high and positive monetary impact as well in the United States. In the United States. Some fun key numbers that we saw when doing our research. 30,000 people, more than 30,000 people are diagnosed with HIV every single year in the United States. There's a prevalence of people living with either diagnosed or undiagnosed HIV. It is estimated at 1.2 million people as of 2022. The United, I'm going to delete that $. The United Nations Program on HIV AIDS, or UNAIDS, has come up with this 90-90 approach, or they did for 2020, and there's no updated data at the moment. But in they wanted that by 2020, 90% of all people living with HIV will have known their HIV status. 90% of all people with an HIV diagnosis should have received ART, and 90% of people receiving ART should have achieved viral suppression. I don't have any current data, but the data is always happening and improving, so we can update as we get more. So the global response for HIV and AIDS, as well as our Sustainable Development Goal An article by Kuma and colleagues discussed that it is very important for international collaboration, advocacy, and resource mobilization in order to understand and tackle the challenges that having AIDS is. So, access to HIV testing and ART has been a critical issue in the global fight against the disease, and it continues to be an issue in order to have that in all countries, especially developing countries. In 2022, about 9.2 million people living with HIV were not receiving treatment, while about 5.5 million people didn't know that they had HIV. Many low and middle income countries continue to have barriers in obtaining those life-saving medications. So, a lot of the global response strategies have resulted in significant progress for the global fight against HIV and AIDS. So, for example, the UN AIDS 2022 report indicated that since 2010, new HIV infections have declined by 38%. So, from 2.1 million to 1.3 million in 2022. And they also discovered that AIDS-related deaths decreased by 69% and 51% since 2004 and 2010, respectively. So it went from 2 million and 1.3 million in 2004 and 2010 to only 630,000 in 2022. So, why is this a concern for the world? HIV is a very infectious disease and it is not treatable once you have it. So, education and prevention is very important.
Nurses have always played a crucial role when it comes to HIV/AIDS, both locally and internationally. In the 1980s, HIV was not well understood, and there was fear, misinformation, and homophobia with an HIV diagnosis. However, nurses have been the backbone to caring for these patients. According to an article from the University of Southern California, nurses played a crucial role in caring for HIV/AIDS patients, providing comfort, symptom management, and often in the early days of the disease, palliative care for those who were dying. Today, as nurses, we still hold an impact on HIV/AIDS patients. Our best interventions we can implement is prevention. Some of the things that we can do is provide education regarding HIV and AIDS. We can provide patient-centered prevention and counseling, and then we can also assess for patients for HIV and at-risk behavior. According to social determinants of health and care outcomes among people with HIV in the US, fewer than 70% of those people with HIV in the US have achieved durable viral suppression. To end the HIV epidemic in the US, clinicians, researchers, and public health practitioners must devise ways to remove barriers to effective HIV treatment. So some of our discussion questions include: how can you promote education on HIV in your workplace? How does education influence the prevention and the stigma of HIV? How does HIV education impact long-term public health outcomes?
All right, so we have three discussion questions for those who are watching as well. And then we wanted to ask these questions to each other. So, Rachel, how can you promote education on HIV in your workplace?
Personally, I've had the opportunity to work with an HIV positive individual who came to our hospital because they were experiencing symptoms and they received the HIV diagnosis with us. The education I provided for this person was to get in contact with the previous sexual encounters that they had and inform them that they had tested positive, obviously, so they could get tested, as well as provided education on barrier contraceptives. So in this case, it would be condoms. And this is to be able to educate both past sexual encounters as well as future sexual encounters, because we know people who have HIV can still have sex. It's just regarding having safe sex. And then working in the peds and PICU population, we get to see a lot of children who are experiencing at-risk behavior. We can also educate them on safe sex because this is, like we had previously stated, the best way to prevent is providing this education. And in our unit, we even have condoms that we can provide the youth with. But Jack, how does education influence the prevention and the stigma of HIV?
Um, well, I think that it's really important for us who don't have HIV to understand what really HIV is and then how it really transmits to other people or toward us, honestly, because that is our biggest fear for not having HIV. So personally, I've never gotten an experience to meet a person who has HIV. But really, like, I'm not sure that if I'm the only one, but when I think about HIV, it's really not safe, like really to be close to like those who have HIV. But in fact, really, that HIV cannot be transmitted through saliva, sweats, or like sharing a toilets with them. So really, like to understand for us is that the people we cannot isolate those people who have HIV because if we know how to prevent and then if they know how to manage as well, then it shouldn't be a really dangerous for us to not isolate them. So what I want to say is that it is important for us and for them to both know and to be educated what really HIV is so we can create a safer environment, not really isolating those people. Um, because if we isolate them, I feel like they're going to have more problems unless they get help from other sources like us as a nurses. So I think that is why education on HIV is important, so we all know to create how to create a safer environment. So Eugenia, our last question: how does HIV education impact long-term public health outcomes?
So, as we've talked about, HIV is a long-term, lifelong disease. Once you get it, there's not really a cure. There's ways to suppress the virus, but there's no cure for it. So education is really important in making sure that people, the general public, is aware of how to prevent the spread of HIV, prevent the transmission of HIV, and like Jack was saying, even just like the stigma of it, if we are more educated, that reduces the stigma of it, which will in turn impact like the public's perception of the disease, and public health outcomes will be more positive. And yeah, education just goes a long way to make sure that the disease is not spreading as rampantly as it was in the past. And also, people are just more aware on what to do if they do have the disease or if they have loved ones who have the disease. And yeah,
Thanks for all your responses, Rachel and Eugenia.
thank you guys.
This is the position statement from the American Nurses Association. ANA supports efforts to end the HIV epidemic, recognizing that nursing care is central to achieving HIV treatment and prevention goals. ANA's updated policies recognize a treatment as prevention approach and further support access to PEP and PrEP as prevention strategy, as well as access to PEP when indicated for healthcare workers. ANA's updated policies support use of evidence-based approaches appropriate to key target population and encourage nursing practice and leadership that promote culturally competent, non-stigmatizing care. ANA further recognizes a significant role for APRNs with prescriptive authority in HIV treatment and prevention and calls for further practice authority at the federal and state level.
So, some collaborative opportunities. We are all involved in the education and prevention of HIV, from nurses, educators, doctors, NPs, patients, and their families. Some local collaborative opportunities that we found. The biggest one was the Minnesota Council for HIV/AIDS Care and Prevention. So the MCHACP is comprised of people with a stake in HIV prevention and care, and this includes people from HIV affected communities. And this council also operates with the Minnesota Department of Health, the Minnesota Department of Human Services, and the Hennepin County Public Health. And it's a collaborative effort among these different departments. The MCHACP is also responsible for developing Minnesota's integrated HIV prevention and care plan, making decisions and recommendations about HIV treatment and care services, as well as prioritizing populations for HIV prevention services. And this information was taken from their website. The University of Minnesota's School of Public Health also had a really good list of resources as well. We don't have enough time to go into all of those lists, but you can check out that as well.
So, in conclusion, HIV is a virus that attacks the body's immune system, which leads to AIDS without proper treatment. We saw the effects of HIV when left untreated back in the late mid 1900s. It is mainly transmitted by unprotected sex. However, there are other causes and risk factors associated. Our best way to address HIV is education on prevention, which is our chosen sustainable development goal.
And one final discussion question for funsies. What is one new thing you have learned about HIV from this presentation? And we've got our references.
Thank you very much.
Thank you.
Thank you.